continue to be used in crowded spaces like public transport, for example.
Let's talk about that. Lots of other things to do with the easing of restrictions as well with one of our regular GPs, Dr. Rachel Ward. Morning, good to speak to you. So should we start with masks first of all? Obviously, in a medical setting, people will continue to wear them. But what about other settings? What would your advice be and your thoughts?
Morning, both of you. So, yeah, that was a fascinating clip, wasn't it, showing some of the really important facts about masks. So I think we have to come back to that basic fact that if you wear a mask, you are protecting those around you. You are giving yourself some protection, but actually one of the main factors is that you are protecting everyone else. So we have to continue to think of this in a selfless way that, you know, even if you are a young, fit, double vaccinated person, you will be coming into contact with people who aren't as lucky to be as low risk as yourself. So I see it that actually this is a decent thing to do when you are out and about, to continue to wear a face mask. Now, you know, I think if we all continue to do that, especially in crowded places, we will continue to reduce transmission, and that will help people who are vulnerable. Putting a slightly selfish point of view on it, you could say as well, you know, even as restrictions ease, if you get COVID symptoms, you'll still need to isolate and get tested. And if you are positive for COVID, you'll have to isolate for 10 days. So another factor in my mind is that I want to minimize my risk of having to isolate for 10 days. I'm not worried about becoming really ill with COVID because I'm double vaccinated, but I still don't want to get it because of that isolation.
OK, so that's interesting. What about the easing of restrictions? And we're seeing so much planned to be changing on the 19th of July. What do you think about all of that happening on one day, essentially?
Well, it does feel, I'm sure to lots of people, it feels a bit counterintuitive. The Prime Minister was explaining yesterday that by the 19th of July, we may be seeing as many as 50,000 cases per day. So it seems strange to then say that we will be dropping all restrictions, but we did see the very positive data presented by Patrick Vallance that we talked about, that breaking of link, weakening of link between cases and hospital admissions and deaths. Now, it hasn't completely stopped an increase in those numbers, but it is positive because of our vaccine program. Now, I'm sure there are going to be lots of people, you know, great news for people in the hospitality industry, in the entertainment industry. This is a much needed change. However, I think we all need to bear in mind that there are going to be many, many vulnerable people, people who are clinically vulnerable, who this is going to cause a significant amount of anxiety for. You know, it's going to suddenly seem like a very scary thing to go out again. People will feel at increased risk. That's okay to feel like that. I think, you know, we all need to be conscious of that not everyone is going to be as comfortable as each other, and look out for each other.
You make a very good point. And just briefly, we heard as well from him that the time interval between doses for those over 40 will be reduced from 12 to 8. How are you set up to deliver that?
Well, I'm sure we will rise to the challenge again with this change in vaccine dosing. You know, it obviously is a very busy time with the vaccine rollout at the moment, but I'm sure we'll get that done. One thing I would say, Louise, is that we are suddenly finding that we're actually finding it much more difficult to fill our vaccine clinics. We're having to really work hard to get our young population in. Many times that is actually because we're finding that we don't have up-to-date contact details for our younger patients. So if you haven't heard from your GP, please make sure they've got the right contact details, but also please come forward for a vaccine. It is going to protect all of us and keep us all without restrictions as we move forward.
Really good to chat, as ever, on what seems like a significant day. Thank you.
Thank you.
So Louise was saying earlier that we are sort of